Okay, so as you already know, I'm gonna talk to you today about how to do a case report step by step. I'm gonna use one of the case reports I published as an example. So the one I'm gonna talk about today is a case study I published recently called Rapidly Progressive Coexistence of GAVE and PHG. It's a pretty fancy and long name, which is basically one of the things you should know about a case report. It will end up having a large title. Just a little bit of intro. What do you think a case study is? A case study is, well, it's basically a story, just a detailed, has to be factual description of something. Can range between a rare disease, a treatment, an explained outcome, unexplained association, a rare drug reaction, and something new that's diagnostically relevant, or a combination of all of these. So this is the title of my case study here on the right side, and it's basically a combination of an explained association, a novel treatment, and a clinical lesson. Because every case study has to end with a clinical lesson. Um, Medical evidence-wise, why do we think a case study is something important? Why do we work on it? This is the hierarchy of evidence-based medicine. So you can see here the case report is the lowest tier of supported evidence. So it is a low tier, but is supported evidence. And enough case reports or case study would eventually generate a research hypothesis that would lead to a change in practice and guidelines. So even something mundane we use every day, like a penicillin allergy or cancer, even cases of AIDS and other stuff, were once only described as a case study, and now it's generally part of the practice and guidelines. But also, selfish reasons. And this is why I'm doing the seminar anyways. You're gonna need to have research experience if you want to apply for a lot of specialties in the UK and probably outside the UK. So the least you can do in any application when you apply for training is to have a case study. Research experience goes way long. It's very important, but it's really hard for a junior doctor to incorporate themselves for an actual original research. So you can do a case study instead and still give you points. You can use it in your portfolio. You can use it as a research experience if you're already interested in clinical research. This here is screenshot from the IMT self-assessment criteria. So as you can see, you'll have to have published articles, abstract, case reports everywhere, and it gives you a fair amount of points. This one here is from the radiology training application. Again, peer review publication, case reports gives you a lot of points. And this one is from the CST, core surgical training, case reports, and PubMed cited publication. Keep that thing in mind, PubMed cited, because we're going to talk about it in a few minutes. How to choose a case. How did I come to encounter my case? You don't have to see the patient personally. You don't have to be involved in their care. You can only hear about them. You can hear about interesting presentation here and there. A consultant is speaking to you about something interesting, a rare disease, a rare presentation. You've been involved in a conference talking about a new management, or what do you think is an unusual association, unusual outcome, something that you might find interesting. You don't have to be involved personally. So in my case, I wasn't actually involved with this patient at all. I have never seen this patient. I just heard about them in a meeting. The first thing you have to ask yourself is, would another clinician probably learn something if you published this case? If there is a clinical lesson here that you want to learn and teach other clinician, if your answer is yes, it's probably worth doing. Again, this is the title of my case study, and it's a combination between unusual association, presentation, and a novel treatment. Three, all of the three. Okay, let's see. Say you met a case, you heard about a case, you were told about a case. How do you know if it's actually rare or unusual? Is it worth your time or not? Because as junior doctors, we might think something is rare or interesting, but actually it may not be. It happened to me quite a few times when I think something is very rare, it's very interesting, but when I ask my consultant, he says, "Well, no, we see it every day." After all, we're all junior doctors, we don't have that kind of experience. So I think you have to do one of two things. Either talk to your senior, Can't be a registrar, can't be a consultant. Just give them an idea. I saw this and that. What do you think? Is it publishable? Is it something worth working on? The other thing you can do is just do a Google search. Search Google Scholar. That's basically has every bit of evidence, every bit of research embedded in history in the Google Scholar. Just search, see what was published about it. Is it understudied? Is it overstudied? Do they need more research? There is something else you can do, but I don't recommend it way too much. You can submit an abstract before you do the case study. So if you're not sure that your case study is actually publishable, it's something good. You can do a draft abstract even before you do anything, before you consent the patient, before you do the actual case report and submit it to a journal. The only thing why I don't recommend that is when you do an abstract without a case study, it's probably going to be just a draft. It's not going to be something good. It's not going to be a gem. The journal will likely reject it. And if they do, that shouldn't stop you from doing the case study again. And this is why I don't think it's not really a good practice, but you can do if you're really worried. Again, you now have encountered or heard about an interesting case. You've talked to your senior. It is, in fact, interesting. You did a Google search. Yes, it's understudied. I would like to publish that or talk about this. First thing you do, I'd say, talk to your senior, let them know out of common courtesy, especially if you're not caring for this patient, so you're not even the doctor. You'll have to let your consultant know if you want to consent the patient because he is not your patient. The second thing is, well, one of your seniors might have beaten to you already. Someone else might have swapped and, well, consented the patient and started it. And this is why I think you need to speak to a senior because maybe they will tell you, well, you're too late, unfortunately. Your colleague X has consented the patient. You can aim for a time scale of 3 to 6 months. If it's a really good study and you're time committed, it can be even less than 3 months to be fair. But aim for a maximum 6 months. 6 months for a good case study would be enough. That's from the moment you start to consent your patient to publication, 6 months would be okay. There is probably dozens and dozens of consent form on Google. You can use any of them. This is my favorite just because it's only one page. There other consent forms, maybe 4 or 5 pages. This one from the BMG, it's pretty much straightforward. So I'm gonna let you see in a second how did I consent the patient. So yeah, here you go. Again, so just print out the paper. You write the patient's name in there. I had to scratch it off. And you describe what you're going to do. So when you consent the patient, you'll have to let them know why you're doing the case study. So go, yeah, well, I think this is rare, this is interesting. It would help clinicians better do this and better do that. You'll have to let them know why you think you want to publish their disease, their story in the hospital. Very importantly, you'll have to let them know it's nonprofit because most patients, unfortunately, do think we do get money from this, which is, in fact, we do actually pay money. We don't get any money. So let them know this is not profit and this is only for the soul of science of medicine. Just a quick description of what you want to do. So you're going to describe the case, you will describe the diagnosis and treatment, and the photos and labs you're going to use. Now, if it's relevant to your case to get pictures of the patient themselves, you can. First of all, you'll have to put it down in the consent form and you will have to put it as it's going to be anonymized. So if you had a picture of the patient face, you'll have to cover their eyes if it's not medically relevant. In a recent case study I submitted, we had to take a picture of the patient's upper arms, chest, face, and neck. We had to cover the eyes because it wasn't medically relevant, but the rest of the face has to be apparent in the photo. So we told this to the patient, and it was written down in the consent form. Then this is a provisional title. It's only a provisional title. So you can put the title, you can even leave it blank when you consent the patient and put the title later. The patient will take these boxes and then they will sign. You see that part here? Relationship to patient, if patient not signing this form. What if your patient is below 18, which is considered a child in the UK? What do you think we should do?
I guess the guardian or parent.
Amazing.
Amazing.
So yeah, it's probably going to be one of the parents, which is the guardian. Unless they don't have parents or there's social issues, it's going to be the legal guardian. So yes. What if your patient doesn't have capacity, say advanced dementia or mental health? What do you think should consent? Who do you think should consent the patient? And very good thought, but apparently in this case, it's very, very complicated than I thought. I've never actually attempted to consent someone with no capacity, but there is no legal thing that would suggest a lasting power of attorney can consent a case study for a patient. But again, there is no legal thing that say they can't. So it is very complicated. And if you search left and right, you'll find all opinion says, well, if it's in the best interest of science, just do it. If you have to do it, I will suggest two things. First of all, you'll have to involve the family, either next of kin or lasting power of attorney. You'll have to involve them, let them know. Even if they don't approve and you're still going to do it, let them know it's good practice to involve the family. It's not very good practice if they woke up in the morning and find their mother's face in some case study online. No one wants to feel like that. Second thing is involve a consultant in each step. So the consultant should be there in the consent, should sign the consent form, and should be supervising your case. And this is only for your protection. It has to come from a consultant. Okay, we did the consent. We're ready to go. We want to write our case study. First step would be critically appraise past studies. In simple terms, I want to write case study. There is no case study you would think of writing and publishing that hasn't been published and written before, to be fair. It almost never happens. Everything you want to publish is published before. So why would a journal take your study seriously? Well, if it's better than the other studies, and this is what we're aiming for. So you want to pick the pitfalls of past studies or past case reports done so you can actually make a better one. Long ago, before AI, what we used to do is we did search Google Scholar. So I did have gave associated with PhD, and we had to read each case study and think, okay, well, my colleague X in this case study failed to mention this, but he did a good job in mentioning Y and this and that. But thank God for AI, we can now use ChatGPT. Just copy and paste the link for the case study you want to critically appraise and ask ChatGPT to critically appraise it. As simple as that. They will give you the relevance, they will give you the strengths, they will give you the weakness, and this is what you should be working on. So if it's something bad about a case study, you really don't want to do it again. If it's good, keep it or improve it. We critically appraised the case studies. We do now have an idea that we want to share. First thing I would say, just write a draft story. As simple as that. Maintain chronological order. You see here on the right side, that's an actual draft of what I used when I've written this case study. So the first part about doing a draft story, don't start with, okay, well, this patient is non-CKD AF. It's not a case presentation, it's a case report to be published. You're not presenting something in a handover. So start with the age and sex of the patient, which is almost relevant in almost all cases. When did you meet the patient or how did you get to know the patient would be your first clue. Did you see the patient in A&E? Did they come with bleeding? Did they see patient in the clinic? Did they come with shortness of breath? I saw the patient because he was referred to fast track pathway for iron deficiency anemia. And this is the first part you should be starting your story with. How did you get to know the patient? Then a little bit of background, and then by chronological order, I mean in time order, you go into the findings. So, well, the colonoscopy of 2020 didn't show much, but actually he had a positive fit test in 24, so he required another colonoscopy. Again, didn't show anything. At some point, someone requested a CT that showed this and that. Well, it showed something. It showed portal vein prominence. So they did an ultrasound and they did an OGD and stuff. Maintain chronological order is very important, especially in patients who deteriorates fast. you'll have to put months. You can put the year. You don't have to put days, but at least you have to put months and years. Your draft story should end with the treatment. What did the treatment, what kind of treatment did the patient have? And what follow-up, what the outcome? Was he dead at the end of the hospital stay? Was he transferred somewhere? Was he discharged? What kind of follow-up he had? So basically, just a draft story, starting with when did you see the patient and how? A little bit of background, then the story ending with treatment and follow-up. You do now have that draft story. You'll have to complete your story. No story without visuals. I'd say review your lab's photos, imaging, and pathology. Make sure you have them on hand. You have them in safe hands, especially if you're working in a hospital that's paper-based and not electronic. It's going to be a hassle for you to try to gather these all. And if you don't have these, you don't have a story. So before you go into other steps, just make sure you have the lab photos, the imaging, CTs, MRIs, endoscopy, pathology, anything, even the pictures of the patients. Remove identifiers before you keep them on your laptop or computer or your phone. You have to remove the identifier, otherwise it is a breach of patient confidentiality and it's a big deal. So identifiers can be a name, date of birth, hospital or NHS number, and these are probably printed on the film of each imaging or endoscopy photo. You'll have to remove the address as well. Cover face or eyes if they are not relevant. If they are relevant, you can keep them, but you'll have to tell the patient and consent them for it. There's a lot of ways you can construct a case report, but my favorite, because it's the easiest, is this one. So you start with a case presentation. This is the first part you write about the case, a case presentation. You can go to either introduction or discussion or vice versa, and then leaving the conclusion at the end, and we'll talk about the abstract later. Okay, case presentation. It's basically you describing everything that happened since you saw the patient until they were discharged, and even if there are any follow-up. It's a basic story. Remember that draft I show you about the chronological order? We're going to make it into a beautiful multi-paragraph story with a lot of fancy words. First thing you want to mention is when you met the patient. Again, so you met the patient, she was referred on the iron deficiency anemia fast track because of this and this and that. You remember what was the second part of our draft? A little bit of a background. So this patient has a background of a CKD, AF, blah, 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 and then ending with a dual chamber implantable cardioverter defibrillator. And in my case, this was hell important. This was the cherry of the case study. And if it's something really important, you either want to mention it very, very early or very, very late, because this is what's catching the eyes. It's either the last part of each paragraph or the first part of each paragraph, and I left it at the end. Okay, how did you meet the patient? A little bit of background, and then you'll have to go by chronological order, tell the story. Again, colonoscopy in 2022 didn't show much. Well, positive fit test, so they did a CT, they did a colonoscopy, they did this and that, and the ultrasound did this. Something you have to know is you'll have to be very specific with the numbers. You can't say a patient came in with low hemoglobin or low ferritin or he had elevated blood pressure. You have to be very specific. So it has to be, well, I mean, hemoglobin of this and that, an MCV of 75, a ferritin of 7, a blood pressure of 160/80. It has to be very, very specific. And if the patient received treatment, are you trying to describe the treatment has to be in doses and in correct units. Be very wary about the units of your labs. So hemoglobin is gram per liter. In Egypt, they use milligram per deciliter. It's okay to use any unit, but you'll have to be very wary to use the correct unit within your lab. So very specific with numbers, and remember that even if you're describing that the patient has improved, his hemoglobin is improved to what? Improved by how much? You'll have to mention that as well. And ending the case presentation with treatment and follow-up, and the outcome of the patient is very important. If your patient has died, is it okay to publish a case study? So if they consented before they're dead, they can. If they didn't consent and they are now dead, lasting power of attorney and next of kin can consent. And this is kind of very different to if the patient doesn't have capacity. If the patient is dead, you want to make sure they died expectedly. If they died unexpectedly due to malpractice or any other thing, you really don't want to do a case study because, well, you're probably going to go to the GMC. So even if the patient is dead, you can still publish a case study and you can still write that the patient died. If the patient was discharged, you'll have to say that they were stable, they were discharged, what was the structured plan for the follow-up. That's really important. After all, it's a patient, it's not just a story. Now, you might be wary about using ChatGPT in doing this bit, in converting a draft into an actual story. What do you think about using ChatGPT? You can use ChatGPT to build parts of your story, but it has to be completely anonymized. No patient information whatsoever. If you're using photos, make sure you have removed the identifiers before uploading the photos on ChatGPT. If you use patient identifiable information in ChatGPT, is going to be a huge deal. It's a huge malpractice. It could be even struck off the GMC, so you have to be very careful about it. The other thing is, most journals now do have an AI checker. They do check if you used AI for the whole case studies, which is not bad. It's okay to use AI. Just switch a little bit of words here and this. Replace words, reform some sentences so it wouldn't be alerted. And that's it. You can absolutely use ChatGPT in the case discussion. Okay. You don't use references in the case discussion. So this discussion is basically, the case presentation. So in the case presentation, you basically just describe the case. You don't have to use any references. If you want to add a little bit of references when you're talking about, well, how the rare the disease is or something, you can, but you don't have to, because the majority of references will be used in that case discussion itself, which is the second part. Long ago, we did used to do the referencing manually or by hand. But again, now, thanks to AI, you can use the Harvard generator online. The Harvard reference is the most common and acceptable kind of referencing almost among all journals. So this is basically what we can do, what we usually use for case reports or any original research or meta-analysis or anything. We do use the Harvard referencing. That's a link for a free website that does the referencing for you. So you go for any relevant case, any relevant research, any relevant study you've seen online that you want to reference into your discussion. Just copy the link, paste it here, click search, and here you are. That's a reference. Just copy to clipboard and number it as, well, number 1, number 2, and so on, and put it in the references paper at the end of the discussion. We did the case presentation. That's our story. That's very easy because that's what we know. That's what we met the patient. The next thing would be a discussion. So I like to go discussion, introduction, conclusion. Some people can do introduction, discussion, but I find it easier if I did discussion and introduction. Discussion is the bulky part of your case, because discussion basically means, why do we choose to publish this case? Discussion is you trying to sell your case to the journal. Please accept this for publication. Why did you write this case? In discussion, you want to start with a tiny intro, just a little bit of tiny intro. Well, the disease X is rare and it's often unrecognized, it's understudied, and we think it's rare because this and that, and you'll have to put a reference right then and that. If you mention something is understudied or rare, you'll have to put a reference. Remember, the case discussion is the bulky part where you put most of your references in. Another paragraph to why you think this case is distinct Again, this is you trying to sell your case to the journal. Why you think your case counts? Why should we accept your case? Well, this case demonstrates several instructive points. The rapid evolution, well, the novel treatment, the unusual association. Well, you expect the patient to act like X, but he acted like Y. Look at the imaging. This looks very rare. Why do you think your case is important, is distinct, and why it should be published? The other part is, if you are going to speak about a new or unusual treatment versus a standard treatment that we know of, you want to pick at the treatment a little bit. You want to trash it a little bit. You want to come to the old or standard treatment that we use and find the pitfalls. Find the contraindications. Find the cases where we can't use this treatment and mention it loud and clear. So in my case, where it is, yes, in my case, the patient couldn't be treated with the standard APC, argon plasma coagulation, because of cardiac devices. He had an ICD implanted and we can't use the treatment in ICD. And just again, trash it a little bit. Well, APC, we know the patient will probably need repeated sessions. There is a higher chance of recurrence. Well, there is not much alternative. There's suboptimal treatment on recurrent anemia. Again, trash it a little bit and then add your treatment, add how it was completely successful in treating your patient. Don't forget, the last part will have to be outcome of your patient and the follow-up. What did we do? This is the case discussion. Again, it is the bulkiest part of the case report, the most important part of the case report. It is you selling to the journal why you think this should be publishable and most of your referencing. The more references you use, the more credible it is. It sounds controversial, but this is what journals believe, unfortunately. Now we'll go to introduction. So introduction is a little bit different from the abstract or from the case discussion itself. Intro is short, 200 words maximum. The short, the better. Start your story a little bit differently. So in the discussion, we did start the story with the disease itself. We met the patient. The disease was very rare because of this, because of that. It was an unusual association. In introduction, we're still going to talk about how rare it is, but just start differently. So in this part, I used, well, iron deficiency anemia is common. Frequent cases include this and this and that. And less common is GAVE. Just be a little bit mysterious. Start with iron deficiency anemia and end with what you want to say. Just a little bit of GAVE here. A small information about what GAVE is, as in pathophysiology, not as rare, but as the disease itself, where it's characterized by this and this and that. It's radiating from the pylorus and antrum. And almost all case studies will have to end with the same. So introduction will have to end with this part. We probably have read it like a million times so far. We present the case of an elderly woman. So here we go. We present to you a case of this and this and that, highlighting or underscoring something. So highlighting the complexity of the case, the success of the treatment, the rare condition, the unexpected outcome. So this part is very important to put in the intro. It's intriguing. Last but not least, the conclusions. You'll have to, sorry. I didn't mention, in introduction, you'll have to use references as well. So now you have references definitely in the case discussion. In the introduction, you can use references in the case presentation if you can. If you can't, that's fine. Conclusion. So the conclusion is basically just a breakdown of each part of the case, but with mentioning what are the highlights, what did we learn. Important thing to know about conclusions, you cannot use any references. Conclusion is your own conclusion, not any other clinician or colleague's conclusion. It's you basically says, what did you learn? What are you hoping others would learn? So please don't use references because, well, it's not going to look good. You're not allowed to. Break down the case, a little bit of paragraphs. What did you learn about the case presentation, about the treatment, about the follow-up, about this, about that? And then end again with this case thereby reinforces or highlights 1, 2, 3, 4, 5, 6. So the introduction will end with, we present to you this case because it highlights the complexity of this, but the conclusion it's a conclusion, so it will end with, therefore, we have highlighted or we have showed you the importance of this treatment or that association. We still do have the abstract, but I'm leaving it until the end for a purpose. You do now have your case. We've written the case presentation. We have done the case discussion. We have done the conclusion. One of the things you have to do before you go to the abstract or colors or images is to revise the spelling and grammar. Back in the Edge, we did use, I can't even remember the name. There was like a company where you have to pay them money and they will do the grammar and spelling check, and they did take a lot of money, to be fair. This is the link for an AI tool. It's called Grammarly. They do check the grammar and spelling for you. They can substitute some words. They can even add fancy words if you want. If you're struggling with this, that's fine. It does have an option for AI checker as well. So if you think your discussion or your case presentation is full of ChatGPT thing, you can use Grammarly to let you know, and you can change a little bit of words. Be aware of abbreviations. In original research, you can do a table of abbreviations, but case studies, just because they're very short, they're basically one paper, we don't do tables. What we do is, when you're using the words or the abbreviation for the very first time it comes in a case study, just write it down as whole, and then the abbreviation in between brackets. So that's gastric antral vascular ectasia, and being in between brackets gave. It's the same for IDA, the same for PHG. You can use abbreviations, but you have to mention it very first time in between brackets, and then you can use it. Don't use unusual or international abbreviations, please. Don't use PT for patients. We do know that GAVE is gastric enterobacterial ectasia. We do know that IDA is iron deficiency anemia. If it's something that's not international, you can't use it. That's unprofessional, I'm afraid. Okay, we've almost finished the case study. We still have the images, the labs and stuff, and we still have the abstracts. You do have the images on hand, you do have the CTs, the MRIs, the endoscopies, you do have all of them. What you should do before you put them in place: labels, captions, and arrows. What's the difference between labels and captions? Any idea? Any thoughts? Okay. This is the first photo I used. Labels is this. Figure 1, Figure 2, Figure 3. It's basically the label you're going to put on the photo and use in the case report itself, in the text itself. So in the text, when I want to talk about this photo, I'm going to say, well, as you can see in Figure 1, or as you can see in Figure 2, this is the label you're going to use both in the photo and in the text. The captions is a brief description of the photo, brief description of a table, of a graph. Every image you use in a case report should absolutely have captions. So this one here is a OGD, March 25, normal gastric mucosa, no vascular lesions. If you have more than one image of the same entity, as in more than one CT scan, more than one MRI, more than one endoscopy, like in my case, you'll have to put the date. Again, apart from if the patient had his endoscopy March 2025 and then a week later he had another one, just put a week later. You don't have to put the date itself, but otherwise just put at least the month and a year. Arrows. Arrows refer to, you pointing out what you want your reader to see, as in abnormalities. Just because this endoscopy here is showing normal gastric mucosa, we didn't use any arrows because I'm not pointing out anything. It's all normal. Every part of this is normal. But look at this. So this is the second endoscopy the patient has. That's in August 2025. Again, that's a label, that's a caption, which is a brief description. You'll have to put errors, and this is one of the mistakes I didn't do when I submitted it for the first time. So the very first time I submitted this case, I forgot to put errors, and they emailed me to put errors and resubmit it again. So I put multiple errors, just highlighting the same thing. See, that's called watermelon stomach. That's vascular ectasia. That's GAVE. All the arrows are the same color because they all are pointing to the same pathology. Meanwhile, the other photo here, again, label and caption. You don't really have to do that, but it's good practice if you use two different colors, two different arrows, just because I'm pointing at two different pathologies here. So you do have the black arrow here pointing towards the GAVE, and you do have the white arrow here pointing towards the BHG. Again, this is one of the things I didn't do and was a mistake. And then you will have imaging. That's a CT. The first arrow here is pointed toward the nodular margin of the liver. The second one here is pointing toward the recanalization of umbilical vein, and this is a sign of severe portal hypertension. Label, caption. You'll have to see what you think the readers should know about this. Not all your readers are radiologists. Not all your readers are gastroenterologists. So that is basically just pointing out to tables and graphs. Again, one of the mistakes I did is I work in a hospital where we do have electronic system. So the system itself does have tables for patients for the trending of blood tests like hemoglobin and urea and stuff. And amazingly, the system itself generates graphs based on that. So I just took a screenshot. I removed patient identifiable data. I labeled it, I captioned it, and I sent it. But they didn't like it. They wanted a to Z table you do yourself, either on Excel, on Word, whatever, but they wanted your own table, which was easy. I just copy pasted the stuff in an Excel sheet and did it. The problem was with the graph. So that's a graph. You don't have to use graphs, but I didn't have a lot of photos to use, so I thought, well, that's gonna look good, especially because it's trending up and down. Because, well, if you see here, the patient came in with low hemoglobin, sudden drop, and then improvement, which proves my point in this case. I'm not good at graphs, to be fair, so I didn't know how to do a graph. I put down the table into ChatGPT and asked them to generate a graph for me, and he did a good job. Put the images in place. All the images should be in the case presentation. You're not discussing your findings, you're presenting your findings. So all images, all tables, all labs, they have to be in the case presentation bit, not in the case discussion or anything else. Now, almost done. The last part is the abstracts. Something very important to remember about abstracts is no references. Abstract is a brief description of the entire case and the entire part of every case. It doesn't need referencing, shouldn't have referencing. That's your doing. There's two types of referencing. The types of reference, the abstract. There's two types of abstracts. The type of abstract mainly depend on the journal itself. So this is the one actually I used. This is the first one I used when I published this case study. It's called multi-paragraphed abstract. The multi-paragraph abstract has a maximum of 250 words, but the journal wanted to have a one-paragraph abstract, which is a maximum of 200 words. There is no right and wrong in abstracting. It depends on the journal. How would you know? You can see the guidelines if they have the guidelines online. If not, just submit the case and they will tell you, well, change the abstract to this or that. No journal would reject a whole case study just because they didn't like the abstract. They will tell you to change it. And this is only for journals. But if you're submitting an abstract for a conference, for a presentation and conference, it absolutely has to be the second one, which is the multi-paragraphed with a maximum of 250 and the authors in as well. Now, we do know the abstracts don't have referencing. The case presentation, no referencing, and conclusion, no referencing. Please keep that in mind. The last bit is the authorship. You've done your case study. You put down your images, you've done your abstract, you're about to publish it, you're about to send it to a journal, begging them to publish it. Before you do, I say just ask someone for a review. Either it's a colleague, a senior consultant, just ask them for a review. They may have an opinion. They may say, okay, well, let's rephrase it this differently. We'll add this, we'll add that. That's relevant. If you're new to research, you're probably going to end up just mentioning a lot of irrelevant things in the introduction and the case presentation bit, especially in history, which is fine. I used to do this, like in the first 3 case studies I've published. So make a consultant review it. Make one of your colleagues, it doesn't have to be a consultant, any senior colleague who has published even once before would give you an idea about any edits you need. The authorship in case reporting is different from original research, as in it doesn't really matter. It doesn't matter at all. If you're doing an original research or a cohort study or cross-sectional study or meta-analysis or these fancy words, it really matters if they're a first author, a co-author, or just an author. In case reporting, it doesn't really matter at all. They are basically all the same. Case reports can be done solely by one author. So you can alone publish a case study with no help. I wouldn't really recommend it, but you can do that. So it doesn't matter. A corresponding author mainly is the one who will email the journal, will submit the abstract, will submit the case, will respond to their edits, will respond to, well, the rejection or their acceptance. And the corresponding author is the only one who can do the edits. So let's say I'm the corresponding author and one of you guys is my co-author. Again, they're basically the same thing, but I'm the one who is emailing the journal, and the journal asked me to remove this and remove that. It only can be me who edit it because I'm the only one who will have access to the account where I can edit it. Unless I give you the password, that's another thing. First author is the one who leads the writing and data. The co-author contributes with any other thing. Again, in case reporting, it doesn't really matter. What about the senior author? What do you think a senior author is? Should they be involved in a case study?
Doctor.
Sorry, say again?
Probably a senior supervisor who is giving us the clinical data or something.
Okay, he is a supervisor. It doesn't need to add anything. It doesn't need to give any clinical details or anything. But in a case study, you don't use senior or last author much, to be fair. It is a fundamental part of any original research because you can't fund an original research without a senior or a last author in you. They're not going to give you the money or the approval. In a case study, it's only important if, as I told you way earlier, if there is something controversial about the case itself. So if the patient's dead, if the patient doesn't have capacity, even if it's a child, you don't really need a senior or last author. But if in doubt, you can put a consultant down as a senior author. He doesn't do any of the jobs. He just reviews, he gives you their opinion. They are usually the last author, as in they are written down as the last author, so they won't get all the spotlight. It's about you as a junior doctor because you need to do this. As you can see, this is again the self-assessment application for the IMT, I think. First author, joint co-author, corresponding author, co-author, the same. It doesn't really matter if it's a case study. They accept literally anything. They give you the same points. The difference between points is basically the amount of research you've done, not what were you as an author at all. Okay, publishing. Almost there. You've done everything. You've reviewed it. You have the consent form. You checked the AI checker. You checked your grammar, photos in place, abstract is done. You now want to do the publishing part. There are 2 types of journals. There is generic or general case journals, and there is a specialty specific journals. One thing you have to know about journals is you really want to submit to a journal who is PubMed cited. Peer-reviewed and PubMed cited. Any PubMed cited journal is probably peer-reviewed, but it's not vice versa. I would recommend Curious and BMJ case reports for a submission. They help a lot of junior doctors. They're very flexible with their edits and reviews, very flexible with their timing and timelines bounds. So I would really recommend them. Curious is very famous nowadays because, again, they accept a lot of case reports, especially from junior doctors, very flexible with the editing. You can submit to specialty specific, like, Blood Advances is for hematology, European Heart is for heart. EASCO is an international journal for surgical oncology and gastroenterology. How many journals can you submit to at once? Endless amount of journals. Just submit to whatever you want. What if all journals have accepted your publication? It doesn't matter. It's not going to give you extra points. It's not going to give you less points. It's not going to make you more credible. If it's in press, it's in press. If it's published, it's published. That's it. But you do submit to a lot of journals just to try to secure. So if a journal rejected, another might accept or put it under review. Again, you'll have to make sure your journal is PubMed cited. This is a mistake I did with the very first case study because I did choose EASCO and EASCO is not PubMed cited and I did not know that. And I ended up not getting points at all because of this. So make sure your journal is PubMed cited. The best way to know is ask ChatGPT. You can email the journal just asking them, hi, are you PubMed cited or not? As simple as that. You published the case study. Now, you do have 3 outcomes. The first one is either acceptance. You receive an email, well, it's accepted, we're going to publish it. I'm not going to lie, that's not very common. It's not very common that a paper you will publish will be accepted at once. So if it's not, please don't be depressed. The other outcome is rejected. And the third outcome is under review or needs editing or reviewing. If it's rejected, it's not the end of the world. First, you can submit to other journals. That's fine. The case study beta I submitted to EASCO and was accepted. It was rejected by other journals, so that's okay. Not just because it was rejected by someone, it's not going to be published. You can still submit to other journals. You can still do something about the rejection, though. You can email the journal and, thank you for letting me know it's rejected. Is there anything I could do? Is there anything I could improve? They might give you an idea. They might give you an idea, even if they are no longer accepting your abstract again. The idea might help you submitting the same case report to another journal. Now, the commonest outcome is this one, which is needs review, needs editing, which I almost got it for all the case reports I have published. This one is the same case report that we've been talking on. And I had this recently, I've received this recently. So, dear authors, abstract should be continuous paragraph and not divided into subsections. That's something we mentioned. We already talked about this. The abstract itself, paragraph or multi-paragraphs, basically just depends on the journal. One or more tables have been submitted in a picture. They want these tables to be added in Microsoft Word or Excel. Again, we've talked about this. We've done this. Okay. Please add arrows to the imaging and to show areas of interest. Again, this is a mistake I did. So we did put arrows and send it again. And they wanted more references in the discussion, which was pretty much easy. Again, there's a lot of case studies. Just put in the referencing. What's relevant, you can put it down. If you have, say, a sentence that is mentioned in 4 studies, you can literally reference the 4, 1, 2, 3, 4 for the same sentence. That's fine. If they need more reference, you can do that. And resubmit it again. Hopefully this time it's going to be accepted. So when a research or a case study is accepted, that doesn't mean it's going to be published tomorrow morning, not next week, and maybe not even next month. If it's accepted, it's called in press. Because journals do have editions. They don't just publish journals the next morning. They wait. They do have dates and timelines. But if it's accepted, it's called in press. And it's in press, it gives you points. Again, this is an application for the IMT self-assessment. It says in press. So published, cited, in press, in press, in press, in press. If it's in press, it means it's accepted. And if it's accepted, you get your points. That's fine. That is pretty much it. I want to thank QuickPass for giving me the opportunity to talk to you all about the case studies, and I really hope you've learned a lot.